Hey, South Hills Community Wellness, Jacqueline Battaglia here, and we're doing a live interview with Dr. Ian Bulow.
Oh,
Okay.
I can hear you now. I lost you for a minute. That's been a call coming through. Sorry to interrupt.
So Dr. Ian Bulow is the owner and clinical director at Revive Upper Cervical Chiropractic, which is located on Rowan Rd in Cranberry Township. Dr. Bulow will be presenting this Thursday at 10 a.m., but we wanted to ask him a couple questions today to prep for that for that presentation. So, Dr. Bulow, welcome.
Thank you so much. Sorry for interrupting you earlier. I had a call come through and it messed it all up. That was my fault.
No, that's okay. Can you tell us what upper cervical chiropractic care is?
Sure, absolutely. It's a little bit of a mouthful and it sometimes can be confusing, but I think a lot of the people that you're connected with probably understand that upper cervical chiropractic involves the spine. So cervical in this context means the neck. We kind of specialize in balancing and realigning the spine from the top down. So it's kind of this speciality, if you will, within the chiropractic field that focuses on that, on spinal realignment from the top down. And that's what we do.
I know I've had neck issues a lot of my adult life, so this will be very interesting, and I'm excited to learn more about that. But what are common issues and ailments that you treat?
Yeah, that's a really good question. We see people from all walks of life, believe it or not. So even though we specialize at the top, we'll see people very commonly for middle and lower back tension and pain. But where we really shine, to be honest with you, is people that have reoccurring chronic functional issues as well. Things like post-concussion syndrome, facial pain syndromes, chronic headaches, whether it's migraine or cluster or tension headaches, and even things in the digestive system. There's this, connection between the brain and the gut that a lot of functional people understand. If your brain is stressed out, it's going to really upset your gut. But if your gut's not healthy, it'll really upset your brain's healing. So it's a two-way street, and we influence the top-down, side of the aisle there. But that's where we see a lot of people with chronic headaches, dizziness and vertigo, neck and back pain, of course, reflux and irritable bowel type issues, just because, again, when you're in a state of fight or flight, it tends to create a lot of these common problems. And then structurally, if the weight of your head is not balanced appropriately, then it does tend to cause reoccurring shoulder and lower back and hip issues. So aside from the really kind of aggressive and interesting functional problems that I was just mentioning, the other category that we see are people that do well with traditional chiropractic and therapy measures, but they've kind of hit a plateau point. They get adjusted, or they get their therapy session and it feels good for a matter of hours or days or maybe even a couple weeks, but it seems like they go back to the same old patterns, and a lot of that can be traced back to a balance issue in the weight of the head. And so those are the types of cases that we see and we tend to do well with.
That is so interesting. So my last question for you then is, what are some of the differences in your clinic?
Yeah, there are primarily three. I currently am actually president of the ICA's Council on Upper Cervical Care. The ICA is the International Chiropractors Association. So we have different councils, and that is a question that, as a council, we are really working hard to identify and answer. So we have a 3-year Diplomate program that our chiropractors go through to get certified as diplomates in the upper neck, and then we have a standards committee where we're defining what is the standard. What does it mean to be an upper cervical chiropractor? And basically, it can be boiled down to 3 differences. Most upper cervical chiropractors won't even accept someone for care unless there are objective indicators for the needs of care. So whether it is a postural assessment or a thermographic exam, which is what we do. We use paraspinal thermography, kind of like thermographic imaging, infrared imaging. That's something that's done on every single visit. So regardless of whether there's pain or not, regardless of whether there is stiffness in the neck or not, there is objective indicators that are measurable both before and after the adjustment. So just indicators are number one. They're done on every visit before and after. Imaging is number 2. So upper cervical chiropractors really only work with people after they've got some advanced imaging. So maybe it's some specialized x-ray, maybe it's an MRI, maybe it's a three-dimensional CT scan, which is what we do. It's really cutting edge stuff. So imaging. And then the last difference is that most upper cervical chiropractors, when they work with someone, there's no bending or popping of the spine involved most of the time. There's one exception to that rule, but other than that one exception, all the different board certification techniques that you can get in this work involve people lying on their side with their head supported, and there's an impulse in the side of the neck. So there's never any, again, with the exception of one, there's never any cracking or popping noises or things like that. And so those would be the three differences. So very conservative and measurable differences that are done before and after any session. Imaging done to determine custom adjustments is number two. And then number three is those adjustments are generally done with the patient lying on their side without any bending, twisting, cracking, or popping.
Wow. I can't wait for my first appointment. That's all I have to say. So Thursday at 10 a.m., Dr. Ian Bulow is going to be diving deeper into this, and we can't wait. So thank you so much for this interview today, and we will see you at Thursday at 10 a.m.
I look forward to it. We'll see you guys then.
Me too. Thanks.